Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Cognitive assessment in children characterizes stages of development consistent with Piaget's developmental theory. One of the cognitive principles typically developed during the sensorimotor stage is A. Object permanence, B. Animalistic thinking, C. Phenomenalistic causality, or D. Learning without reasoning. So this it's a theoretical question. It certainly is very much about assessment because you need to be able to assess the features of these different developmental stages and know which one is which. There's also some words here that you may not think about on the day-to-day, and it's really easy to let yourself get drawn into that. Oh, phenomenalistic causality. What's that? I don't remember what that is. Oh, that's probably the right answer. Don't let yourself go down that path. Now, in this case, we're going to review all of it so you'll know what all of these are. But if it should happen that you encounter something and you think, I have no idea what that is, don't let that be the reason that you choose an answer choice. You want to have more confidence in your knowledge base than that. But in this case, back to this question, it really comes down to one of the cognitive principles typically developed during the sensorimotor stage is what? There are 4 cognitive principles here. Which one is developed during the sensorimotor stage? And the answer is A, object permanence. Object permanence is the ability to appreciate that an object, and in psyche terms, the object, in these terms anyway, the object is the parent or the primary caregiver. Object permanence is the ability to appreciate that an object, primarily the caregiver, remains in the child's life even when temporarily out of visual range. Because remember, in the first couple of years of life, children are not capable of abstract thought. They don't know that if something leaves their visual sight, it's ever coming back. And this is a skill that they developed within those first 2 years. And it's a critical one because it's the foundation of their ability to trust that when something leaves their point of view, it's still part of their world. That's what object permanence is. And it is developed during the sensorimotor stage, which remember, according to Piaget's cognitive development, is the first 2 years of life, birth to age 2. Much of what they learn then is sensorimotor, what to see, to touch, be ambulatory, explore, open cabinets and doors and touch things and touch people. They're just beginning to learn how to differentiate themselves from the world, and they're just beginning to learn that even if their parent steps out of view, the parent is A, coming back, and B, still very much a part of their life. And when they don't develop that, when they can't, when during the first 2 years of life, the child is in living conditions where they don't develop a sense of permanence of the caregiver. Maybe they are, sent from place to place, or unfortunately they live in a circumstance where they can't depend on the caregiver to be meeting their needs. They don't develop this sense of object permanence, and it can really be catastrophic in terms of how they develop relationships the rest of the way through the lifespan. So object permanence is a critical cognitive task or cognitive principle, and it's developed in the first 2 years of life. Now, everything else here, animalistic thinking, this is that way that children have of attributing feelings to like their toys or to inanimate things. Like they will think about how their toy could be sad or could be hurt or something along that order. That's referred to as animalistic thinking. And that's actually characteristic of the pre-operational stage, age 2 to 7 years old. Similarly, phenomenalistic causality, which is, of course, a fancy word, phenomenalistic causality is that phenomenon of magical thinking, like if they think something bad is going to happen, it could happen. Or if they think something really, really good will happen, it could happen. Again, this is something that develops during the pre-operational stage, age 2 to 7 years old. Kids at this age, they really do think that if they really think something or wish for something, it can happen. And of course, later on in the lifespan, they'll learn that that's not the case. And then finally, learning without reasoning. Learning without reasoning is also characteristic of pre-operational thought. So all the other answer choices here, these are things that develop in the next stage after sensorimotor. The next stage of Piaget is pre-operational. It's age 2 to 7 years old. Learning without reasoning is more like conditioned responses. Like they can respond to timeout. They learn that if they do something they're not supposed to do, they might have to sit in timeout. They can't reason why. Like they may not understand that you shouldn't take something that's not yours just because it's not yours. They just learn that if they take this thing, they have to sit in timeout. And if they don't like timeout, then they will stop taking the thing. And that's the difference between those two stages. But object permanence is developed in that earliest sensorimotor stage.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.